Hi there. This is a brief intro to the prescribing warnings that are part of our prescribing module. When you first come onto the module, they won't start popping up straight away. They won't do that until you tell us you're ready for them. We don't want you to get things that you're not expecting or things that people don't know what to do with. Though they are fairly self-explanatory, but I want to show you how it works in practice and how you can turn off ones that you may not want to use or you may already have covered yourselves. So I'm just going to show you on a test patient a few examples of the kind of thing we're talking about. So you can see this patient's on warfarin, mostly because I put him on warfarin this morning to demonstrate this. But let's say I'm going to put him onto a DOAC instead. We get this warning here, but it's not picked up the fact that the patient is already on warfarin. So our pop-up, nothing very clever, but it simply points out this patient is on multiple types of anticoagulant and one should be stopped. If I ignored that or forgot for whatever reason, the patient would then get picked up in one of our Wellbe Innovate reports. So you've got pharmacist to action. We'll look at some of the others in other videos. But this others to consider reviewing is where we're picking up things that link to these alerts mainly. Some are sort of softer, things that are perhaps need review, but not a definite no. Others like this one, you would definitely want to review anyone appearing in those reports. So that's one kind, which is a sort of warning. Then there's others that are a bit more subtle, that are more kind of checks for things. So this one is for paracetamol. And it came out of a significant event where a care home patient was actually overdosed because no one had checked her weight. So if I prescribe paracetamol, this is a test patient, so they've got no weight recorded. And so it's flagging for me here the different guidance about what patients should be prescribed according to their weight. It may well be that I can glance at the patient and know for sure they are definitely over 50 kilos. So I could just put yes. It might be that I can do a recent weight or I've got one and I can put that in. And in the journal, there's a note here, look, weight recorded over 50 in the last 3 weeks because I've just done it. So no need to check whether it's under 50. As you get further away since the last weight, it's got different criteria to work out whether it needs checking again. Now, that's the kind of thing you may look at and you think, actually, do you know what? We do not want that. It's not an issue for us. We'd rather turn it off. So if you want to do that, if you type down here, protocols, this is the easiest way to find things in my experience. You come to Wellbe Innovate and our prescribing folder. There's quite a few protocols in here, and not all of them are prompts. Some of them are for other things. But there's two main sections you might want to look at. The first is checks, and these are the sort of slightly softer things like the one I was just showing you. Check weight when paracetamol prescribed. This one's checking whether the opioid prescribing ladder is followed if the patient's not palliative. So it will kind of, if you prescribe tramadol and have not had any other pain relief prior to that, it will flag that and ask why you're doing that, and also give you the option to send advice to the patient about the risk of addiction with those medications. But say I didn't want that paracetamol one on, you can just turn it off like that, and that'll be off then for your practice. The other section, let me just turn that back on for us because we do want that. If system one wouldn't freeze in the middle of a video, thanks for that, system one. The other section is this warnings. And these are more the things like multiple oral anticoagulants. But again, you may already have things in place. You may think they're not necessary and you can turn them off. Conversely, there may be things that you think we're missing that you would like to add in. So please do let us know. If you think there are gaps or things that would be really helpful for your practice and others, let us know. We'll review them and develop them with you. So hopefully that all helps keep prescribing safe and helps you and your patients. Thanks.